So thank you to every Victorian who is celebrating this special day this weekend in a very different way. It is protecting our health system, it's saving lives. Our strategy is fundamentally working. The alternative, of course, if we look at places like New York and some parts of Europe, is not something that we want to see repeated here. And that's why it was so important to go hard and then maintain those settings. That's exactly what we've done. And I've got a number of announcements to make today, the daily update, but also some further announcements. First of all, I can inform you and all Victorians that I have extended the state of emergency that currently runs across our state for a further 4 weeks. It will expire on midnight, the 11th of May, and may well continue beyond that. That'll be based on circumstances once we get closer to that second 4-week period. This is unprecedented. But these powers are passed by the Parliament. They are the law of our state, and they're designed to deal with challenges just like those that we face, even though none of us in our lifetime have ever had to deal with this sort of crisis. In terms of, and basically those powers, as you know, mean that authorities can enforce and make sure that our strategy is in place right across the state, a strategy that I again remind everyone is working. And that's why I'm deeply grateful to every Victorian who's doing the right thing. Very impressed to think that so many people are heeding the warnings, following the advice, staying home, protecting the health system, and ultimately saving lives. And as I've said to you before, each and every one of us have a stake in this. No family will be untouched by the coronavirus if this gets away from us, as it has done in a number of cities right across the world. Now, turning to our most recent data, we have 1,268 confirmed cases of coronavirus. That is just 3 more than yesterday. 28 patients are in hospital, and a further 16 patients are in intensive care. And sadly, 14 Victorians have passed away. That is the same number as yesterday, so there are no further deaths as a result of this virus. Police have conducted some 19,303 checks, and there have been 92 fines issued in the last 24 hours. Around 900 fines have been issued in total. The second point that I want to make today is that we know that a lot of people are doing it very, very tough, and that those mental health services, those that provide counselling and support, often at the most vulnerable time for Victorians, are under considerable strain. That's why Martin Foley's joined me here today and has put together a first-class package, nearly $60 million in additional funding to support Lifeline and other agencies, other clinical services online, those who can provide support and care to those who are doing it very tough. We know that, for instance, a quarter of calls to Lifeline over these last few weeks have been related to the coronavirus. Many people are coming forward to get mental health care and support who have never done so in the past. So there is significant pressure on all of our mental health service system, and this package will mean we have the beds, we have the counselling and support services, we have what's needed to provide care to those who are experiencing mental illness in all of its different forms. So we send our best wishes to those people. We send our thanks to the staff in our mental health service system. They're doing a fantastic job in extraordinary circumstances, and this funding targeted and directed and developed in consultation with them, I think will make a very big difference. Just as with all the different packages of support and funding that we've announced over these last 3 or 4 weeks, if we need to do more, and we almost certainly will, then of course we stand ready to make whatever investments will get people through these very difficult times. So essentially, at just 3 more cases, that is a very strong evidence that our strategy is working, that we are aggressively tracing where there are outbreaks. We are making sure that this virus doesn't get away from us, because if it does, then our health system will simply be overrun and people will die. I think Victorians know and understand the strategy that's in place. I know it's deeply inconvenient. It is very frustrating that we can't give people an end date. People are giving up a lot. They're doing a lot for each other, and I am very, very grateful to every single Victorian who's doing the right thing. That is the vast majority, and that's why we're seeing such positive, albeit fragile numbers These things can change very quickly, and I'd caution against any complacency or any sense that we'll be able to change our policy settings, wind back some of the restrictions we've put in place anytime soon. This needs to be for the long haul. Otherwise, this virus will simply get away from us. There are many world leaders, many people in different parts of the world in jobs similar to mine who would love to be in the position that Victoria is in. We have tragically seen 14 people die. We have a number of people in hospital. People are doing it tough, I know. But compared to the situation in so many other parts of the world, our strategy is working. To give you a sense, at 1,268, that is the death rate in New York for some 2 days. So if people need reminding or any sense that this can get really bad really quickly, what's happening in New York and other parts of Europe and other parts of the world should give us all a really clear sense that we have to stay the course. We have to keep these settings in place. We have to keep looking out for each other and keep making a fundamental contribution to the health and well-being of every single Victorian family. That's what we're doing. I'm proud of it. I'm proud of you. You're doing a fantastic job in very difficult circumstances. Now, Annalise is here as well, particularly in relation to the flight that has arrived from Uruguay today. I'm pleased to be able to report that has gone smoothly. There is a real challenge when you're talking about moving this many people, such a long journey, many of whom are positive with the virus, but their right to return to their home is paramount, and we simply weren't going to allow them to be left on the other side of the world without possibly the care and attention that they needed. So people have arrived safely. Those things can change. There are many people that have the virus on that flight, but to all of my Department of Health, Public Health officials, to Australian Border Force, and as you know, I spoke with the Prime Minister on Friday evening about this issue, to everyone who's been involved, Minister Makakos and others, this has been a really complex task, but one that has been managed very well, and we wish each of those people and their families all the very best. They'll now be either getting care or will be in a hotel for 14 days until such time that they can travel on for those who are not actually Victorians. Just finally, before I ask Martin to add to my comments, particularly around the mental health package, I spoke with Jacinda Ardern yesterday morning about what's going on in New Zealand. There were, I think, 9 of the passengers on that flight that had started with the cruise in South America. They were going straight on to New Zealand, so it was a comfort to them to know that we were taking such good care of their citizens as well.